Hi everyone, I am Hasnan and you're watching All Info World. I hope you are all fine. So let's start now without wasting any time. Our topic is Propofol. First of all, what is Propofol? Propofol is a widely used intravenous anesthetic agent. It induces and maintains general anesthesia or sedation, making it a popular choice for surgical procedures and critical care management. Now we will discuss about mechanism of action. Propofol enhances the activity of GABA A receptors, increasing the influx of chloride ions into the neuron, leading to hyperpolarization. What's mean hyperpolarization? It's mean increased negativity inside the cell is known as hyperpolarization. Due to this, reduced neuronal excitability and decreased neuronal activity. Now I will discuss about structure-activity relationships of propofol. Propofol contains a phenol ring with two isopropyl groups. Propofol is not water soluble but available as 1% aqueous solution. What is the formulation of propofol? Propofol is made from soybean oil, glycerol and egg lecithin. As we know that most allergies are to egg white due to albumin, and propofol is made from egg yolk, egg lecithin. So it's not contraindicated in egg allergy. Pain due to propofol. Propofol can cause pain reduced by injecting lidocaine before or mixing 2 ml of 1% lidocaine in 18 ml propofol. We can overcome pain by using lidocaine. Sterile technique. What is sterile technique? Propofol supports bacterial growth, so must be used within 6 hours of ampule opening. Propofol contains preservatives like disodium acetate and sodium metabisulfite. Now we will discuss about pharmacokinetics. It's the study of how the body interacts with drug is known as pharmacokinetics. Next, absorption of propofol. Absorption of propofol only available intravenous administration for general anesthesia, induction and moderate to deep sedation. Next, distribution of propofol. Propofol has rapid onset of action and half-life is about 2 to 8 minutes. Propofol has rapid recovery from methoxytyl, thiopental, ketamine or etomidate. Due to low volume of distribution, smaller doses are required in elderly patients, and due to high volume of distribution, high doses are required in children. Next is biotransformation. Propofol is quickly metabolized by the liver due to high clearance rate. This contributes to rapid recovery after infusion discontinuation. Pharmacokinetics unaffected by obesity, cirrhosis, kidney failure. Next one is propofol infusion syndrome, a rare but serious condition associated with long-term high-dose propofol infusion, especially in critically ill children, adults with severe head injuries or brain surgeries. PRIS can cause lipemia, metabolic acidosis, and also can cause death. Now we will discuss about propofol effects on organs. First is cardiovascular effects. Decreased blood pressure mainly due to decreased systemic vascular resistance, decreased preload venous return, and cardiac contractility decrease. Next, factors contributing to propofol induced hypertension. What are the factors which are contributing to produce propofol induced hypertension? These are large doses of propofol, rapid injection, and elderly patients are the main factors contributing to propofol induced hypertension. Next, heart rate and cardiac output changes. Heart rate and cardiac output changes are usually mild or insignificant in healthy individuals and can be severe in elderly patients, patients on beta blockers, patients with impaired ventricular function. Next is respiratory effects. Propofol is strong respiratory depressant, often causes apnea after induction, suppresses body's normal response to low oxygen, hypoxia, and high carbon dioxide. It means hypercapnia. And propofol should be used by only trained staff and a low risk of wheezing compared to other drugs like as thiopental, even in asthmatic patients. And next is what are the effects on cerebral system. Propofol reduces cerebral blood flow, volume, and intracranial pressure. Next, what are the effects on cerebral perfusion pressure? Propofol may critically lower cerebral perfusion pressure with elevated levels of ICP. Neuroprotection provides protection during focal cerebral ischemia, similar to thiopentol. Antiemetic use. Propofol has antiemetic properties and preferred for outpatient anesthesia. Anticonvulsant. Propofol is used successfully to terminate status epilepticus. Next, drug interactions. Administer small amount of midazolam prior to induction with propofol. Midazolam can reduce the required propofol dose by more than 10%. And propofol is often also combined with either remifentanil or ketamine for total intravenous anesthesia. Now we will summarize propofol effects on organ system. Commonly, propofol have no effect on heart rate, decrease mean arterial pressure, decrease ventilatory drive, and have no effect on bronchodilation, decreased cerebral blood flow, and decreased cerebral oxygen consumption, and also decreased intracranial pressure. It's the last point, propofol dose. Induction dose, maintenance infusion dose, and sedation infusion dose. Propofol is administered through intravenous route only. Induction dose is 1 to 2.5 mg per kg. Maintenance infusion dose is 50 to 200 mcg per kg per minute, and sedation infusion dose is 25 to 100 mcg per kg per minute. So this is all about propofol according to Morgan and Michael's Clinical Anesthesiology, edition 7. And if you are new on my channel, kindly follow All Infoword and follow my LinkedIn account. Thank you so much.